welcome. You're watching Beat Diabetes, Facts and Myths. I'm Sonal Mehrotra Kapoor. Now, the COVID-19 pandemic has had both positive and negative impacts on different aspects of our life, lifestyle behaviors as well. The negative lifestyle behaviors associated with an increased risk of adverse outcomes from COVID-19. Because it was dealing with COVID that we ended up overlooking the fact that our lifestyles had been severely disrupted. Many people became physically inactive, developed irregular eating patterns as well, which led to several other unhealthy lifestyle disorders and aggravated several other underlying diseases as well. The COVID-19 pandemic has also caused significant change in homes, in work, in life, in your stress levels as well. So now what's required? A multi-sectoral approach, promoting healthier diets, increasing physical activity as well. That will all help slowing down what is being now called a diabetic epidemic. Also, another issue that has led to several heart diseases cropping up. What are the factors leading up to this increase in the number of diabetes patients and heart patients? And then to address it, what is it really that you and I can do? That is going to be our conversation today, and joining us are experts who will help you advise on how to lead a healthy life. Now let's please join me in welcoming Dr. K. Vasudevarao. He's MD, PG, practicing physician and diabetologist at the Hridayam Diabetes World in the Kalyan. We also have Dr. Umesh Masand with us. He is MD Medicine, FD, FM, consultant physician at the Masand Clinic in Indore. And we also have with us Dr. C.S. Raju. He's MD, DM and the Chief Interchild Cardiologist at the KIMS Hospital in Nellore. Welcome all of you to the program, and let's just dive in straight to the conversation. Let me take the first question to Dr. K. Vasudevarao. Dr. Rao, is there any association or relation between blood glucose control and COVID-19 outcomes as well? We've seen the handling of COVID-19 meant a lot of steroids being used that created another sense of complications altogether, and different individuals responded differently to it. But in the background of that, in a treatment that has been given to so many people based on steroids, are you seeing a relation over there?
First thing is, there's a very strong correlation between poor diabetes control and the COVID-19 outcome. It has been proved in multiple studies now. Unfortunately, if the patient enters in the COVID infection ward with high sugars, he is going to land up with multiple comorbidities very easily. For example, a patient with high sugars, high fasting sugars, or a poor HbA1c, he is bound to have severe pneumonias. He may have a lot of complications in the form of disseminated intravascular coagulations with multiple blocks. He may even land up in multisystem organ damages and septic shock. He may require a lot of external devices like BiPAPs and even invasive ventilators for that matter, and it may even prolong his ICU stay. Of course, it is associated with high death rates also. There are multiple studies which have proved that beyond doubt. Associated with that, there are a lot of laboratory parameters which go on increasing, as we all are aware that the interleukin-6 levels are increased, so also the tumor necrosis factors, the D-dimer levels and the CRP levels. So fundamentally, any high-level sugars are prone for multiple complications, cytokine storms, and a very prolonged ICU care.
All right, good to get that equation sorted out over there. Let me take the next question to Dr. Masand then. Dr. Masand, how has COVID-19 impacted the young population? And, we also saw a lot of young people develop heart diseases, something that we've reported more and more post the pandemic or perhaps during the pandemic. We also saw a lot of young people develop a type 2 diabetes. Is that directly related to COVID-19, or there might be other reasons for it as well?
Yes, I think there has been a surge in cases of diabetes after the COVID pandemic, and especially after the second wave. And a lot of young patients have now been overtly, they have become diabetics. Maybe they were prone to getting diabetes, they were pre-diabetics earlier on, they had a strong family history, but COVID suddenly tilted the disease in favor of overt and full-fledged diabetes. There are certain factors which are responsible for this. One, the patients who were at home because of the sedentary lifestyle, they were locked down at the home, they were doing their works at home, and they were not going to offices, they were not going to exercise. All the gardens and parks and everything was closed. So sedentary lifestyle and the change in eating patterns increased the number of overt diabetes in young patients. Those were not admitted. Second group of patients is those who were admitted to the hospital. There was a lot of stress hyperglycemia. And lastly, the use of steroids, which actually saved a lot of lives in the second wave of the pandemic, but it led to incidence of increase in the incidence of diabetes also. So these are the factors actually which led to the increase in number of diabetic population since the pandemic, and especially in the young population.
All right. Let me take the next question to Dr. Srinivasan, then Dr. Raju there. Dr. Raju, more people experienced high blood pressure in response to COVID-19 as well. And a lot of times it's said that all this is related to stress. It could just be the stress of either getting the virus or not, or just working in an environment like this. How big do you think is that a factor?
If you just look at the data of prevalence of hypertension, in general, in Indian population, almost 1 in 5 individuals are suffering from hypertension. It is so common. And if you see the national data, almost say 25 to 30% of the adult population are suffering from hypertension. With that background, and added to that is the anxiety and the stress related to the COVID and the mortality death rate by watching the news in different countries. So many people are dying, so many people are losing their family as well as the friends due to COVID. That stress is definitely adding to the hike in the prevalence of hypertension. And then not only that, some of the other medicines which are used along for the treatment of COVID, in addition to the steroids. So the steroid usage is very well known factor to increase the hypertension. So added to that, if some people use for fever, if they use an NSAIDs, that is the non-steroidal anti-inflammatory drugs, which are commonly used for control of the pains, body pains, as well as the fever, they are also very well known causes for drug-induced hypertension. So on one side, there is a increased prevalence. On second side, there is increased the diabetes prevalence, which again adds to the hypertension.
Dr. Rao, let me come to you with the next question. Now, people with diabetes have an increased risk of developing a number of serious diseases as well, right? Like the vicious circle I just spoke about. Which are the most serious life-threatening complications associated with diabetes?
Okay, thanks for this question. The answer is very clear. Diabetes is a silent killer. It is silent because it doesn't give any symptoms in the initial stages, and it is a killer because it causes all diseases which literally contribute to serious morbidities and mortalities. The fundamental rule is to keep a test, that is HbA1c test, the value of that test to be kept below 7. That should be the fundamental rule. And if we don't keep that below 7, then you will end up in major complications. And these major complications would be very life-threatening, long-term complications. If I can list it out, the cardiac complications are so common that at least 65% of the patients, they do land up with either heart attacks or strokes. Additionally, it also causes a lot of metabolic dysregulations, like in type 1 patients, you can land up in very serious complications like diabetic ketoacidosis. Elderly people with type 2 do land up in hyperosmolar comas. And not to forget, diabetes is also known to contribute to very serious infections, right from simple urinary infection to kidney infections, gallbladder infections, and brain infections. It can contribute to multi-system organ damage and septic shock and death.
Wow, that's a long list of things that can actually happen if your diabetes is actually out of control. That's a good warning sign to have, perhaps. So let me take the next question to Dr. Masand. Dr. Masand, many people with diabetes feel their feet and legs tingling. It's like pins and needles sort of pricking them over there. The pain, a lot of times we hear worsens at night. Could you tell us what exactly is the reason behind it, and is there a reason, a way really to prevent it?
Yes, this is what we call as peripheral neuropathy, and this is one of the microvascular complications of long-standing diabetes. So diabetes, if not treated properly in the initial 4 or 5 years, will lead to long-term complications. And these are microvascular and macrovascular. So macrovascular are basically heart diseases, and microvascular, basically the nerves in the lower limbs especially are affected, along with retina and the kidney. So what we are talking about is the peripheral neuropathy. The lower limbs either lose their sensation and they become prone to injuries because they don't have sensation, or they get painful sensations like you have said, the tingling numbness and the pin-like feelings, and these symptoms become worse in the night. So basically there is very little treatment for these symptoms if they develop. Once they develop, then the treatment is limited. We can give them some drugs, but the treatment is not very good, and the effect is only 25-30% relief in symptoms. So the best way out is to prevent these neuropathic symptoms to develop. So the best way is to treat the diabetes strictly in the first 5 years. Once the symptoms of neuropathy, retinopathy, they develop, they cannot be reversed totally. And the HbA1c target of the American Diabetic Association and the Indian associations also are less than 7. And there is a legacy effect. You have to treat diabetes early in the course of the disease.
All right, that's a good thing to note. Let's take a break at this moment. When we come back, we continue with this conversation, how to keep yourself healthy, also stay out of diabetes and take good care of your heart. Welcome back. You're watching Beat Diabetes, Facts and Myths, and we are in conversation with our experts. Let me take the next question to Dr. Raju. Dr. Raju, people probably wouldn't ignore a pain in the chest, but people often dismiss a pain in their legs, as there could be multiple reasons for that leg pain, and those reasons at times not taken very seriously. Can heart problems actually cause pain in the legs? I know there is a deep relationship, but often forgotten by people.
Yeah, it's a very important question and a very pertinent question as far as the diabetic patients are concerned. The reason is the blood vessels, the heart is a pump, and it's connected to a lot of blood vessels throughout the blood body. So if the arteries of the legs get choked, or the blood gets clotted in the peripheral arteries supplying the lower limbs, then the patient will have pain in the legs, which is very important as far as the leg pains are concerned, because it is an important warning sign before the gangrene, or before the death of the muscle in the leg happens. So it is very important to recognize this. And the second point is, if there are varicose veins in the legs, that also causes pain in the legs. The third one is, if the heart rhythm is abnormal, like in the form of atrial fibrillation, where the heart beats irregularly, then there will be clot formation inside the heart chambers, which can move from the heart into the peripheral arteries in the legs, and can clog the arteries and can block the arteries in the legs, which can lead to the gangrene again. So it's very important to recognize that the pain in the legs is not an innocent symptom, and we have to react in the right way at the right time to take care of this.
All right, let me take the next question to Dr. Rao. Then, Dr. Rao, both type 1 and type 2 diabetes can lead to long-term complications, right? And if a person does not manage them adequately, management of diabetes really said to be the key here. But could you talk to us a little bit about the complications of diabetes that can emerge in the long run, both in type 1, type 2, and also I really just want to understand people who have diabetes but have controlled diabetes versus people who have uncontrolled diabetes.
Okay, so let's begin with this type 1 diabetes. Type 1 diabetes are those usually children who have zero insulin in their body, and genetically they are predisposed to a situation where there is no insulin production. So at the outset itself, the insulin levels are extremely low or hardly there, and they land up in very severe complications metabolically from day one itself. That is in the form of either diabetic ketoacidosis, and if they are controlled on insulin, sometimes they land up in severe hypoglycemias also. And if the sugars are not controlled over a period of time and they land up in higher HbA1cs, then they do land up in long-term complications, like complications related to the eyes with retinopathy, vision loss, Then there could be a complication related to the kidneys, where there is initially protein loss, subsequently the creatinine starts rising up, and then there's complete renal failure. And then there's a third major complication is in terms of neuropathy, which we just heard about. And over a period of time, they do land up with cardiac complications like angina, chest pain, etc. So the fundamental goal is to get the HbA1c below 7. Of course, it is done by the pattern of basal bolus technique of insulin, or nowadays we have insulin pumps available, with the help of which we can achieve a very good target of HbA1c below 7. The second part of the discussion would be the type 2 diabetes. Type 2 diabetes patients have some production of insulin, but the insulin is not completely working, or there is some significant resistance. But in due course of time, they do also land up in depletion of insulin as well. And so the complications of type 2 diabetes can begin from day one itself. Even in the pre-diabetic stage, they can develop some complications. These complications predominantly develop with either cardiac problems, either they land up in angina, chest pain, or kind of severe heart attacks, etc. They do land up with strokes if they are uncontrolled, and of course the limb ischemia, which we discussed. Additionally, the kidney infections and kidney damages. The infections all over the part of the body, they are all very well known. Retinopathy and vision problems are also very well known with type 2 diabetes patients.
All right, thanks for laying out all those options over there and also giving us what really lies ahead over there. Let me take the next question to Dr. Masand. Doctor, can high blood sugar cause a rash? Should a person consult a doctor for the same as well, or just applying an ointment would be enough?
I think rash can be a very important sign and symptom of something lying underneath. So it should not be taken very lightly, because diabetic patients are actually prone to infections, especially in the lower limbs, and an early sign of infection can be a rash on the skin, but it may be an ominous sign of something developing underneath the skin. So a doctor should be consulted, and the temperature over the skin and the underlying fascia tissue has to be examined, whether there is some cellulitis developing, whether some infection is underlying, and if it is not treated properly, it can flare up, and in the next 3-4 days, suddenly it may become an abscess. So any rash or any redness, any discoloration of the skin diseases are very common in diabetic patients, and especially if the blood sugars are very high, the skin gets involved, and there are a lot of skin disorders associated with high blood sugar. So a simple rash can turn out to be anything. So it should not be neglected, and it should be examined properly by a doctor.
Last few minutes of the program, so let me ask Dr. Raju the next question. Dr. Raju, if you could explain to us what is a cardiac rehabilitation and why it is important for people who have undergone any sort of cardiac procedure to have a home-based cardiac rehabilitation possible.
Cardiac rehabilitation is very important for any cardiac procedure like bypass surgery, post-angioplasty, or after sustaining a heart attack, or after undergoing any valve replacement operation, or for that matter, any cardiac ailment for which patient is hospitalized, like heart failure or unstable angina. In all these conditions, we have to bring back the patient physically, psychologically, and socially, so that he can move back to the family as well as friends. So that is the essential part of cardiac rehabilitation. The rehabilitation starts in the hospital itself. Once the procedure is over, from the next day onwards, we keep ambulating them, we keep moving them, we keep asking them to dangle their legs by the side of the bed, and then making them slowly walking, and then doing respiratory physiotherapy as well as the movement, slowly increasing the frequency as well as the duration of the walking. And then once the patient gets discharged from the hospital, when he reaches the home, he can continue the domiciliary rehabilitation, which includes, as I said, the physical part of it, including the walking, and the psychological factor that he should come out of the fact that he had sustained the cardiac ailment as well as the cardiac surgery, and then he has to come back to normalcy. And the third one is the social. Social rehabilitation involves making him contact with his friends, family members, then getting back to normal. All three are important. Once the intensive part of it is over, different stages, with incremental rehabilitation, you can bring them back to normalcy.
All right, that's all the time we have on the program today. To Dr. Rao, Dr. Masand and Dr. Raju, thank you all so much for your time. That's it on Beat Diabetes. We'll see you again next time. Bye-bye.